Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today, and I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging and we want to help you be more successful. And our guest today is Susan Snedaker. She's Chief Information Officer at Rio Health and just recently released a new book called Renovating Healthcare IT, Building the Foundation for Digital Transformation. We're going to talk about that, but welcome, Susan.
Thanks so much, John. I'm really excited to be here.
Yeah, excited to learn from you. You come highly recommended. So, when I saw some of what you were doing in this new book that you have, I'm excited to have you on. But for those that don't know you, tell us a little bit about yourself and El Rio Health.
Sure. So I've been the CIO at Rio Health for about 3 years now. Prior to that, I was at a large community hospital system in IT doing a variety of roles, including information security. El Rio Health is a federally qualified health center, so an FQHC, which means that we provide primary care for the most part, as well as behavioral health and dental health for underserved populations. We are the 20th largest in the United States, but we're the largest in Arizona. So we serve about 135,000 patients every single year. I joined El Rio at a very unique time. It was in the middle of the pandemic and the middle of a migration from one EHR to another. So it has been a very unique experience, but very rewarding.
You were through the fire. That's
Several different ways.
yeah. I had that for my first job in healthcare. They'd already chose the EHR and they said, implement this. I was like, okay, I guess that's what I'm doing. It was, kind of that same experience as far, switching, I guess we were kind of switching off this old medical manager thing. But anyway, I think it's great that you're at FQHC. I describe them as the gem of healthcare that a lot of people don't even understand. So I appreciate the work that you do. I mentioned your book that you launched. Why did you decide to write your book, Renovating Healthcare IT?
Well, I've written a number of books on technical topics and one on healthcare IT leadership. And over the last several years, before I joined El Rio, I was looking at the IT landscape. I was talking with my colleagues and various professional organizations. And what I kept hearing and kept seeing was, this notion of technical debt and legacy systems and hybrid environments. And I kept thinking about it, thinking we've got to clean this up and we've got to get things sorted out, because the next thing that's coming, and this was before AI was really on the landscape, I kept thinking we can't digitally transform an organization that is just a mashup of technologies. And before AI became the buzzword, it was digital transformation. And I think digital transformation is still a legitimate concept. It just isn't getting the airtime. But I thought, how do I, as the leader of this IT organization, get us ready for a more digital future, more digital than we have today? And I began looking around, and I've said this a couple of times to folks, I tend to write the book I want to read, because I go out and I do research and I look around and I search and search, and I'm looking for this book that says, here are the components, here's a roadmap to get there. And when I don't find it, I say, okay, fine, I'll write the book myself. Because now I've done a lot of research, so I simply augment that research. I round it out, I come up with a book concept, and a few times I've brought it to my publisher. In this case, I emailed my publisher and I said, hey, I'm thinking of writing a book. And I gave her not exactly this title, but roughly. And within 10 minutes, she replied back in all caps, I love it. When can you have it to me? And I thought, uh-oh, I think I've hit a vein. So, but that was exciting to get that level of enthusiasm from her. And so it took me 9 months, but I got the book to her as fast as I possibly could. And I wrote it in order to provide basically a roadmap, an action plan for any CIO or actually any IT person to figure out how to assess a healthcare IT department, how to determine strengths and weaknesses, and then how to really come up with a plan to remediate that. And I know, as well as any other healthcare CIO, what the challenges are, right? We have tight budgets, we have short staff, we have difficulty getting staff. We have to upskill our staff. We have an organization that's hungry for technology, but doesn't always have the capacity to absorb and deploy it. We have a mix-up of old legacy technologies and cloud technologies. I mean, I know all of those things, and everybody else is going through that. So I wrote the book so that it was in actionable segments. So if you're a CIO who likes to create the grand plan and then work your way down, you can do that. If you want to work segment by segment, you can do that. Because my thinking is any improvement is good. So it's not an all or nothing. And the old phrase that perfection is the enemy of good enough is really true here. It's like, get started. Don't get overwhelmed by the enormity of the task. You can pick whatever chapter you want to start on and say, I want to focus on IT processes because I can control that. Great. Or I want to focus on cybersecurity, or I want to focus on technology. I mean, there are just different ways to slice and dice it. So hopefully it's a good combination of very directed action in a very flexible format.
Interesting. I think you just gave the best, most concise description of why the job of a healthcare CIO is so hard, right? All of the challenges that you described there was what they're dealing with. And you're right. I've found through this CIO podcast, you can take a lot of different approaches. You can be the rah-rah CIO that's just vision and inspiration and all that, right? And here's the plan and we're going to execute it. Or you can be more of the data-driven relationship, like we're going to build relationships and we're going to go segment by segment. I mean, so it's interesting how your book kind of applies to those different CIO personalities almost, I would say. And that each can be successful is interesting. I imagine some, this is a little sidebar, some listening probably want to write a book. Like you've written a couple, which is pretty cool. Like, what would you say to someone who is like, I want to write a book about IT because I have some expertise or experience? Would you tell them, forget about it? That's a lot of work? Or what would you say?
Well, I would have a few things to say. One is don't expect to make a lot of money on it. That's the notion that people go in thinking they're going to make money. And while, yes, I get compensated for sales of the book, it's not paying off my mortgage. So
it's dinner.
Right. So I don't mean to dismiss that, but that's not the reason to do it. If you want to write something, you first have to be passionate about it. You second have to be somewhat knowledgeable. You can always do research to become more knowledgeable. And you have to have the long view. It took me, as I said, it took me 9 months to write this book. And that's the whole process end to end. Researching it, writing it, editing it, submitting it, working with the editors at the publisher, revising it, making it flow properly, final review of the final things that are going to get printed, and then the book pops out. But I had been thinking about this topic for probably a couple of years prior to writing it. So it's a long process. But I would say if someone's interested in writing a book, they might want to start with writing blog posts or writing journal articles, something smaller, to see if it's something that they like, if they do it well, if other people say, yeah, that was really helpful, or that was very interesting, or that was well written. And then jump into a book, because a book is a big commitment. When I first started this out, I had been hired to write technical chapters for books. Like I remember one of the first chapters I wrote was on TCP/IP. And I was in pig heaven because I love technology and I was so excited to be able to explain TCP/IP. And so I wrote a chapter, and then another book I wrote 3 chapters, and then another book I wrote 6 chapters. So it sort of evolved from there. So I've been involved in, I think, 12 or 13 books over the years, 4 of which I've written, and then a few others I've co-written, and then a few others I've done chapters. So I think that would be the way for folks to start if they think they're interested in writing.
Interesting. Yeah, I tell people if you want to write a book, it's good for getting consulting and it's good for getting speaking, but it's not good for making money otherwise.
Right.
Sounds like you agree.
Exactly.
Cool. Well, as you look at the book, is there maybe like one takeaway from your book that every CIO should kind of take to heart? Is there something one, I'm sure there's a lot, but is there one that you could give that would be like, oh yeah, every CIO should think about this?
I think it's not specifically information that's in the book as much as what the book provides, which is, as a CIO, and my CIO colleagues and I all acknowledge the job is large, it's evolving, it's demanding, and it's easy to sometimes, especially when you're overwhelmed or tired or frustrated from some of the challenges, to step back and say, listen, I just need to kind of keep things status quo for now. We've had enough change. And I think that's the wrong approach. I think the change we need to have is the change we can inject and control into our own function. And when we can control that change to some degree, it doesn't feel as enervating. It's much more energizing to say, I'm going to look at this aspect of my business and I'm going to help fix it today. And I'm going to get my team on board with a plan. They're going to create the plan. I'm going to approve the plan. I'm going to set them off on it and then check in with them from time to time. And people kind of get energized by that sort of freedom to be innovative, to fix things. And those are things we can control. So I would say, absolutely commit to looking inside your department and figuring out what you need to fix today and what you need to fix tomorrow, because it doesn't get any easier the longer it goes. And these legacy systems, these hybrid things, everybody I know has Active Directory issues because they're just 20 years old and it's just a big mess. Fix it. Work on fixing that. Like, take active steps, and it feels more controllable. It feels like you can accomplish something because it's within your control. And I think that's what the book really points out: is pick your topic, pick your area, and just work it, because there are a lot of small things you can do that make a big change.
Interesting. You mentioned kind of AI in relation to the book and kind of overtaking digital transformation, if you will. I might even say AI is forcing digital transformation in some organizations. You don't have a choice. But how do you think AI is accelerating impact on the demand for IT, and what can a CIO kind of do about that? Because you're right, AI is exploding and has taken over the conscience, the dialogue of health IT.
Yeah, it sure has. And, I think of AI right now as the Wild West, because it really is very unruly at the moment. But if you look at like the Gartner hype cycle, right? And I looked at a chart for technology from 2023, and it shows AI at the very top of the hype cycle. And so I think they actually were a little early in calling it at the peak, right? Because they're saying it's at the peak of that hype cycle and that we are headed for the trough of disillusionment. I completely agree we are headed for that trough, but I'm not sure that the excitement has yet peaked.
Yeah.
But plus or minus 6 months is really not relevant. But I think that's where we are, right? Everybody's totally excited about it. Everybody wants it. Everybody thinks it's going to be magic. And there are a lot of people saying, yeah, well, but hold on a second. So I've talked a lot with my team and with my executive colleagues in our organization about AI, to say, how do we want to handle this? How do we want to approach this? And I started this conversation probably about the time ChatGPT blew up, because I saw what was coming and I said, listen, we need to be ahead of this, and we don't know what it's going to look like, but we should put guardrails around it so that as it evolves, we're prepared. And we did that. So we've got basically a loose corporate policy around AI so that it doesn't just go out in the wild by itself. But my philosophy and my approach with our organization has been to, sort of boldly pilot and slowly deploy, right? So I don't want to commit to a technology that's going to change in 3 months or 6 months or a year, or a solution that keeps morphing. But at the same time, I think piloting is really important, because it tells us a couple of things. It allows our end users who are asking for this to see and feel and touch what this looks like. And they get excited, and then they get to see the reality of it. And I think that's important, because if we sort of keep it at the gates and say, no, not yet, not yet, it just builds demand. It just builds curiosity. So I say, let's pilot this stuff wherever it's safe. right? Low risk, high possibility of impact. So, AI with automation on inbox or in basket messages in the EHR, or drafting responses for providers to patient portal messages. Like, those are low risk kinds of things, and it still requires human intervention. So it drafts something, you as the human have to read it, approve it, submit it. Those are very low risk. So yeah, let's do those. Let's try those. Let's see if that improves our productivity or reduces the cognitive load for providers, which I think is a huge potential for AI. At the same time, I don't want to select a system that is kind of risky and probably going to change 6 times if we don't have to right now. So I see it as we really are headed for the trough of disillusionment, because people are waking up and saying, okay, AI is not perfect. It is not the huge answer. Here's a really sort of brief but good example. AI has been used for imaging diagnosis for a while, and it's a pretty stable AI platform because it's been shown that AI can spot anomalies in digital images more readily than humans. Great. So use it to find hairline fractures or early cancer or whatever. But as these algorithms are now have to be FDA approved. So the FDA approves an algorithm, but oh, wait a second, it's only approved for adults. Okay. So that's sort of the fine print. And it's like, will it not work for children? No, but it's not approved because it hasn't been tested. Will it be tested? Well, we don't have a big enough population to test it.
Welcome to pediatrics.
Right? But those are the kinds of things where I think, especially in the CIO role, we have to be super aware of, because we have to look at all the real fine print and say, what does this actually do? What is it going to do for us? What are the risks? And really help the organization be smart about picking and choosing while this is emerging. I've been in IT long enough where I've seen these disruptive cycles many, many times. And it follows the same pattern, which is why Gartner's got their well-known chart. But it's why we who've been in IT know these things are going to evolve. And the time to put your stake in the ground and really spend a lot of money on a solution is not right now, if it can be helped. So we are investing in and utilizing AI where there's kind of low risk, high probability of success. And the other things we're just taking our time and evaluating.
Yeah, I mean, you're bringing up so many interesting points around, if you put too many guardrails, well, to me, that just means this shadow IT is coming your way, right? Because they're not going to
Absolutely.
stop, right? So that's one problem. The second one is that, you bring up, how do we know that this application of AI, this solution, is going to last long term? And even related to that, am I going to have 100 AI solutions, right? Like, or am I going to have one that does 40 things and another one that does 50? Like, it goes back to best of breed versus a true one platform. I mean, you've seen that cycle with EHR, right? I mean, the exact same thing it feels like is going to happen with AI. So I think it's so interesting. But to your point, I love the idea that you're trying it, because it's hard to know where you are in the cycle if you're not trying the solutions. How do you manage that, right? Like, because you do want to embrace it, but you don't want to end up with 80 different AI applications that then you have to consolidate. And now I guess they're reading your book again about app rationalization and how to consolidate. Is that the cycle, or how do you avoid that cycle?
I don't think it can be completely avoided, right? So from my perspective, I think, we're going to pilot things that we think have some shelf life to them. And if they look like they're quickly evolving or riskier, generative AI in healthcare, kind of, that's deep space right now, right? I mean, it exists, and there is some really reliable stuff, and there's some that's not so much. So I think when we pilot, we look at, will this potentially bring significant benefit to the organization? And if so, at what cost? So we do a little ROI, we do a little business case. And we don't make it overblown, but we really look at those different elements and we say, let's try this, let's pilot this. And we go into a pilot with setting the expectation, both with the vendor and with our users, that this is a pilot. And we may or may not choose to move forward at the end of the pilot. But these are the things we want to learn. So it's about asking a lot of questions and saying, what does this look like? Will this benefit, et cetera? And then at the end of the pilot, we stop and we assess and we say, did this drive the result? Yes or no? Was it what we want? Because a lot of people get excited about AI and they kind of want to force the answer to yes, because it's exciting and it's kind of cool and new. And I get that. But, our job and my job in particular is to say, okay, but hang on. It didn't meet these 3 criteria, and I think those are important to consider. Let's pilot something else, or let's pause. Let's let this technology mature a bit before we jump back in.
Yeah.
And to your point, and I think you really raised a very valid point, which is if we don't say yes enough, we get shadow IT because it's so easy to come by these days. So most healthcare organizations have policies against shadow IT, so that helps. Hopefully finance and contracting groups
support it.
I've got great teams in both that regard, and their first call is to me and say, this contract just came in and it looks like it might be IT, can you take a look at it? So we've got really good guardrails around that and really good users who understand that IT is their partner and a helpful partner. But at the same time, I want people to experience these things and feel empowered to bring forward ideas and solutions, and we can say, sure, let's test it in a small environment. Let's give it a shot, see what it looks like. And that really builds those trust in that relationship, but it also helps us in IT learn a whole lot more about our environment and what our users are really looking for. And that makes us better business partners.
Yeah. We've seen some of the AI ones. I've heard stories where they implement it and the doctor's like, you're not going to take this away from me, right? But that's a good signal, right? That's what you want to hear.
Absolutely. Yeah.
Doctor satisfaction matters. But let's shift gears a little beyond AI and talk more broadly. What do you see as kind of the biggest challenges that CIOs are facing and kind of what can be done about that?
Well, I think AI is sort of the icon, if you will, for many of the challenges that CIOs have always faced. This is just the latest iteration of that. Technology continues to evolve incredibly fast and faster seemingly each year. And at the same time, what's really exciting is, we have so much healthcare data that we're now beginning to be able to do evaluations and analysis on larger data sets than ever before. And then applying AI to that can be incredibly powerful and exciting in terms of being able to. So we're an FQHC, we work in primary care, but it's great to begin seeing data that says, for treating type 2 diabetes in this particular population, we have found protocol A 60% more effective than protocol B. Well, that's just data-driven best practice. And our providers can say, great, for this population, I'm going to try protocol A first, because that's most likely to get me success. And to me, that's really the excitement and the power of where we are right now with data. But as CIOs, we also are looking at, as most people have budget constraints, most people have staffing constraints. And the organization's demand is accelerating. And so I always say to my team, there will always be infinite demand and we will always have finite resources. So we have to help the organization prioritize because we can't have everything. And so my job as CIO is to work with my peers and say, okay, I hear that you want X or Y, but you have to understand that these are the parameters. And if we want to do this, we need more money, more staff, more this, more that, or what should we take away? And that seems to be sort of the big eye opener, because I say, sure, we can do that. What should we stop doing? What should we take away? And I say it nicely, and I don't mean it in any other manner, but
just
that it's a kind of a zero-sum game. And so, and I don't think healthcare is particularly good at taking away. I think that's one of the problems we have in technology is we just keep adding and adding and adding and never step back and clean out the junk drawer. And that's sort of what my book is intended to do, is like help you clean out the junk drawer and get rid of some of that stuff so you have the time, the capacity, the money, the staff to do these new interesting things. So I think that's going to continue to evolve as a challenge. especially as this AI technology thing evolves. I really can't say where it's going to be in 2 or 3 years, but I know it's going to be a radically different landscape. And so we have to be prepared to be nimble. And
Yeah.
I think that really goes back to staff. So I've been thinking a lot about staff. We have trouble, like everyone does, getting qualified folks. And and I'm sure many of my peers also have said, well, we can't hire them, so we're just going to have to grow our own. And that's fine, but that takes time. And that has a much longer runway, but it can yield really much more fruitful results in the long term, but you need a short-term plan as well. And that's really where it's challenging. So I say we also need to become better leaders, because I think in IT, when we have really solid leaders who understand the business of healthcare and they understand the technology they're responsible for, and they can manage people effectively in this very hybrid world that we live in, that's where we're going to find success. And so those are the areas that I think we need to focus on for the coming years to really be prepared for the future.
Interesting. You know, as I look at the role of CIO, 30 years ago, most CIOs were keep the lights on, implement some desktops, make sure the network's working, the email's working, right? It was kind of keep the infrastructure up. And it's kind of evolved into more of impacting the business. I mean, we see that when the EHR goes down at, sadly, ransomware attacks, et cetera, it disrupts the business in a massive way and impacts lives. How do you see kind of this role of the CIO shifting over the next 10 years, or even longer if you want?
Well, I don't think my crystal ball goes out quite that far, but
Yeah.
right. But I agree. IT has shifted, healthcare IT has shifted, and we are now at the center of the conversation. And that doesn't make everybody happy. There are a lot of people who would really love to not have IT be so central to the conversation, but the fact is that it is. And I think
If it's not,
CIOs,
it's even worse, right?
absolutely, absolutely. Then you have a really big problem.
Yeah.
But I think, for me, because I have a business background as well as an IT background, and I've worked as an employer, an employee, and a consultant in my career. And I think that gives me a really unique perspective in terms of I can work with my counterparts in the clinical areas, in the business operations areas, and have a basic understanding of how their role functions and what the organization does, so that I can be a partner with them and say, listen, we can do that thing you want to do, or here's some other options. And I feel like we have moved from being order takers, right? I want this new thing, please go get it, to coming forward to the organization. And I do this a lot. And I say, I'm seeing this opportunity. There's this technology and you guys are struggling with this. This might be a good fit. What do you think? Do you want to take a look at this? So helping them understand how to better leverage technology on behalf of the organization, because we're going to see stuff in a technological perspective that nobody else will. And our end users are struggling to solve various problems. So when we have really solid relationships, especially at the executive level, being able to have those conversations and saying, I think technology could help here. Or, you know what, that's actually not a technology problem, that's a process problem. So you guys need to maybe go take a look at your process, and then we can talk. And I say it nicer than that, but that's the bottom line, is that it's either people or process or technology, and technology is usually the last stop, or it should be.
And it's often all of them. But if you can't
Usually.
figure out the people and process, the technology is not going to solve it.
Exactly right.
Yeah.
Exactly right.
Not the magic elixir you're looking for.
Exactly.
We wish, but very interesting. Well, Susan, we always like to wrap up these podcasts with a little career discussion, career advice, something like that. As you look back at your career, what would you say is maybe the best piece of career advice you've been given?
You know, I don't know that I've exactly been given career advice as much as I've had a couple of, I think I've had probably 3 managers in my career who were really stellar. And I learned a lot from just participating in their process. So as opposed to career advice, I think what I learned from those 3 is the situation is usually more complicated than you know.
Mm.
ask more questions and listen carefully. And that has really served me very well, especially in healthcare IT, which is both complex and complicated. And it's not always easy to get to an answer. And so I have found that what's helped me be successful is to ask a lot of questions and to listen. And I have a really good example that just came to mind is at my other organization, I oversaw the entire biomed function.
Okay.
And it was a very advanced hospital, so we had cath labs and hybrid ORs and advanced imaging, everything. And that was part of my responsibility. And I had a person, Carla, who was the manager over that area, and she was incredibly competent. She was awesome. So shout out Carla Brish, you rock.
I love it.
So I had just taken on this responsibility, and I was sitting down and we were talking. And we were like in a bit of a heated debate, and I was a little surprised, and she was just holding her ground, which I appreciate. And I was kind of holding my ground. I thought, okay, Susan, you're the leader here. You have to find the path through. So how are you going to do that? And so I said, hang on a second, Carla. I said, when I say the word monitor, I'm talking about a computer monitor. What are you talking about? And her face just completely changed, and she said, oh, I'm talking about a cardiac monitor. I was like, okay, good. So now let's reset. So with that definition, now I clearly understood what she was talking about. She clearly understood what I was talking about, and we moved through it. And it was a really good example of ask more questions and listen, because we were both assuming we were using the word in the same way, and we weren't. And in healthcare, that happens all the time. So I sort of find myself being the chief translator. And I find that that's a really helpful role in a lot of conversations. So those three managers who taught me to really ask questions and to listen carefully helped guide me into this career and the success that I've found.
Great advice. And I think there's a humility there, right? To be able to ask more questions and not act like you know it all. I think that's beautiful.
Yeah, and I think anybody who acts like they know it all is going to find that they are sorely disappointed, because nobody can know everything. And so, I rely on my team to be the experts or to go find the experts, and together we know everything, but one individual doesn't and can't.
Yeah. This is awesome, Susan. Well, I'm really glad that we had you on the program, and that you were able to share some insights and perspectives from your experience as CIO. And also, everyone needs to go buy your book. I'm sure it's on all the major platforms. Just search for Renovating Healthcare IT, Building the Foundation for Digital Transformation. Appreciate you sharing your insights and perspectives. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com, or search for the CIO podcast by Healthcare IT Today on your favorite podcast application. Thanks, Susan.
Thanks so much. I had a great time.